Welcome to the video tip of the month for February 2024. It's all about something called orthostatic intolerance. Orthostatic intolerance, also called OI, is one type of autonomic nervous system dysfunction. When it occurs, it makes it very uncomfortable to remain upright, either in a sitting or a standing position. It's important because up to 50% of people with myalgic encephalomyelitis, chronic fatigue syndrome, and long COVID experience OI. And it's important because it's treatable, and I'm going to share some tips on how to manage it yourself. I myself have had orthostatic intolerance my entire life. I can't count the number of times I passed out in the middle of embarrassing situations, like in medical school, doing surgery, etc. The day I got accurately diagnosed and treatment was recommended really changed my life. What is going to trigger or bring on an episode of orthostatic intolerance? It's basically any situation in which the blood flow to your brain is decreased. This could include standing in line, especially if you're not able to fidget. Anything that lowers blood pressure. This could include being out on a hot day or taking a sauna or drinking alcohol. Eating a big meal, because this sends a lot of blood to the intestines and away from the brain. And anything that causes inflammation, like a mast cell activation flare. What are the symptoms of orthostatic intolerance? Basically, they're all symptoms of not having enough blood to your brain. So they include lightheadedness, and in the worst case, fainting or passing out, difficulties thinking and concentrating. Often people get a steady, quite severe headache at the base of their skull, and generally just don't have the energy and stamina they would like to have. In addition, in some people, the heart tries to compensate for the lack of blood flow to the brain by beating faster, and these people get palpitations and shortness of breath. Now, management falls into two main categories: things that require medication and things you can do yourself. I'm going to mention a few of those. Number one strategy in the moment that you're feeling unwell is to lie down right away, because when you're horizontal, it's much easier for blood to get to your brain. Don't try to fight it. It is totally not worth it. Oral rehydration can help increase your resilience to being upright. So this includes taking salt or electrolytes in 2 to 3 liters of fluid throughout the day. For some people, especially if you get pooling in the lower limbs, compression stockings can be extremely helpful. Some people even get inflatable suits that compress much of their body and push the blood back to the heart and up to the brain. Cooling vests can be extremely helpful if you live in a very hot climate. And keeping your muscles toned by frequent movement is another strategy, because the leg muscles help push blood back to the heart. If you want to learn more about orthostatic intolerance, go to my February 2024 blog post. In there, I go into much more detail than in this video, including the medications that have been shown to be effective in research studies. And I'm excited to announce that the inaugural lecture of my new expert webinar series is going to be on March 1st, 2024 by Dr. Peter Rowe, a professor at Johns Hopkins University, who is an expert in the interface between autonomic dysfunction, including orthostatic intolerance, and ME/CFS and long COVID. Don't miss it.